Thank you very much, Attorney Renee. This is a review of the literature regarding mental health, particularly with law students. In our study, we adopted the World Health Organization definition of mental health. And there are 4 important factors for mental health, and these are being able to realize one's abilities, cope with normal stresses of life, work productively, and make contribution to one's community. And mental health is very important for the well-functioning of our community. And according to She, 2013, these are the risks to well-being, which impact productivity. Of course, the physical health, if one is ill, one can be unproductive. And then there are also behavior risks that impact productivity, such as poor health habits, poor eating habits, use of substances, social and emotional risks, such as loneliness, lack of social support, work-related risks. This is related to cognitive overload, like being overworked. And financial health risks, like if you have to worry about putting food on the table or paying the next month's rent, then that could affect one's productivity. Then these are the sources of academic stress for law students. So on top of the normal stresses of regular people, these are the stresses for the law students, the heavy workloads on top, then highly competitive nature present within the legal profession and the academe, and also inadequate feedback and feeling of lack of competence. This is related to the feeling that one is not enough, imposter syndrome. Like I'm just nagpapanggap lang, okay? And then innately pessimistic and adversarial nature of law, like being argumentative, have to be right, and the Socratic methods commonly adopted in the law school, which would really task students' abilities and, of course, communication skills as well. Next slide, please. And these are the primary stressors for the law students: the lack of balance of family life, work life, academic life, conflicts in interpersonal relationships, and there are also problems with prospects for the future, like, am I going to pass the bar? Where am I going to work? Are they going to accept me, etc.? And then performance pressure, like there's a need to really perform. And financial issues, like some law students are raising families, and they are in between jobs, and also employment. Okay, so this is another problem for our law students. Next slide, please. And these stressors associated with psychological symptoms such as depression and anxiety are, number 1, workload stressors. Okay, because of the lack of time to complete a lot of course requirements and lack of time to engage in self-care activities like going out with family members or exercising or minding one's habits or eating habits. Next slide, please. And this particular study by Organ et al., they studied law students across America. The findings show that 25 to 30% of respondents reported substance use. These are maladaptive practices or maladaptive coping, and it's associated with mental health issues. And this majority of these students who have mental health issues, they resist consultation. Next slide, please. And mental health struggles throughout. There are studies also that show the mental health struggles of students throughout their course in the law school. Initial level of well-being and stressors are similar to any other students when they first go to school, to law school, and then they become 2.4 times more likely to develop levels of the stress as they attend their classes, etc. Compared to medical students, and they develop mental health symptoms within the first months. And symptoms worsen as they attend those years and will only decrease 2 years after they graduate. Next slide, please. This is a more recent study in UC Berkeley with 15 law schools across the United States. The reports of the law school students are this. There's lower mental health issues when they felt there's this perception of social support, and not just support from loved ones, but also support from the universities. And there's increased in mental health issue when there are housing problems, and also lacking in secure jobs, and of course the increasing cost of commodities. Okay, so this is just an illustration of the trajectory of mental health issues among law students over the years, which will only drop 2 years after graduating from law school. Next slide, please. And there's also this, what we call the lawyer personality. This is associated with the Holland's theory that one's choice of career is related to one's personality. Like, for example, the lawyer personality, lawyers, they pre-select their career because they have this inclination to be rational in their decision making, to be logical thinkers, to be communicative, which is why they choose to be a lawyer. And the grit, okay, just this concept of grit, which is associated with stick-to-itiveness, determination, and perseverance in pursuing one's long-term goal, it is found to be not related to success in law school. This only means that there are other factors that are related to success, such as social support, socioeconomic status, etc. And grit is higher in females than in males. Okay, thriving in times of COVID. This is for the general population. What does it take to thrive in spite of the pandemic? According to study, these are the factors related to thriving. The physical health, one should be healthy, and then spirituality is another. But connectedness, being able to reach out to social support or maintain relationship with other people, as well as sense of agency. Sense of agency is related to intentionality. Na ikaw mismo, you'll make ways not to secure mental health, and also job security. And yes, lastly, connectedness and sense of urgency are the highest predictors, and high psychological well-being associated with intentional coping, while low psychological well-being is associated with passive coping. Ano yung passive coping? Passive coping is you're not really aware of your mental health issue, and probably you just engage in activities that are really passive, like watching TV, surfing the internet. As compared to the more active, intentional coping, this is when you seek support from others when you need it, and being mindful with your diet, exercise, probably journaling, and other mental health habits. Thank you very much. Now I'll call on Dr. Grace Gomez for the results of the study.